All right, we're going to go live with Dr. Theresa Tam. She's having a press conference in Ottawa, and we'll join her. You're listening to Depictions Media.
Bonjour et merci de vous être joint à nous aujourd'hui. This is a critical week in our fight against the coronavirus. Canadians must continue to practice physical distancing. Stay strong and stay at home unless you are doing essential work like stocking the shelves of our grocery stores or working on the front lines of our healthcare system. I know that we as Canadians are resilient. Things are going to get worse before they get better, but I know that working together, we are going to get through this. Il s'agit d'une semaine critique dans notre lutte contre le virus. Les Canadiens et Canadiennes doivent continuer à pratiquer la distanciation physique. Restez forts et restez à la maison, à moins que vous fassiez un travail essentiel comme remplir les étagères à l'épicerie ou fournir des soins de santé. Les Canadiens et Canadiennes sont résilients. Nous allons passer à travers ensemble. So, today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, le ministre des Affaires étrangères, François-Philippe Champagne, the Minister of Indigenous Services, Marc Miller, et le président du Conseil du Trésor, Jean-Yves Duclos. And of course, with us today are also the Minister of Health, Patty Hajdu, the Chief Medical Officer of Health at Indigenous Services, Dr. Tom Wong, and the Deputy Chief Public Health Officer, Dr. Howard Njoo. Dr. Tam, please.
Bonjour. Hello, everyone. So, as usual, I'll start with an update on the numbers of COVID-19 cases in Canada. There are now 10,466 cases, including 111 deaths. These represent infections from previous exposures and not what is happening right now necessarily. So even if you're not hearing of cases in your community, it doesn't mean there is no risk of exposure. We must all consider that anyone could be infected, and keeping our 2-meter distance is the safest bet. So we continue to test at a very high rate in Canada, one of the highest in the world. With tests completed for over 260,000 people already. Around 3.5% of these people have been confirmed as positive, and 95% also as confirmed as negative. So we talk about these percentages. Well, what does it mean? So Canada has been maintaining around the sort of 3 to 4% positivity rate, which is within a good range for accurate detection of where the disease is circulating. The WHO, for instance, suggests somewhere between 3 to 12% even. So if we drop below this, for example, to 1% positive, for example, it may mean that we're actually casting our net too wide. We're testing a lot of people who might not otherwise really needed testing. People with mild illnesses who are not in an area of Canada where the disease is circulating, for instance. Or you're testing too early. Of course, sometimes the test is not 100%, and some people might need to be retested. But it shows that we have a very highly sensitive testing system. Of course, we are continuing to increase our laboratory capacity to make sure that that is still the case. So the number of cases and outbreaks connected to high-risk settings continue to be reported at a very concerning rate. And in particular, long-term care facilities are being affected in high numbers, and as well as reports of some hospital facilities with healthcare workers impacted. At least 50 deaths are related to long-term care homes, senior residences, and other care facilities. I cannot stress enough that we absolutely must double down to prevent the acceleration of spread in these settings. This means strict public health and infection control policies to minimize the risk of an introduction at these facilities. It also means that every one of us must take all precautions. For people who are not essential workers, this might mean staying away from long-term care facilities while finding ways to keep in touch with loved ones. Using virtual means, such as a phone call or a video, is not quite the same, but staying connected has never been more important. Je le répète encore une fois, cette maladie n'épargne personne. Chaque jour, à mesure que nous recevons des données supplémentaires, nous constatons que tous les groupes d'âge sont touchés. Les conséquences de cette maladie ont été graves et fatales chez les Canadiens âgés et médicalement vulnérables. Mais la maladie frappe aussi sévèrement les adultes de moins de 40 ans, qui représentent plus de 10% des hospitalisations avec quelques cas de maladie grave, au moins un décès. Once again, I must stress that this disease spares no one. Each day, as we get additional data, we are seeing that all age groups are impacted. The consequences of this illness have been severe and fatal in older and medically vulnerable Canadians. But adults under 40 years of age have also experienced severe illness, accounting for over 10% of hospitalizations, with some reports of critical illness and at least one death. Many Canadians are using their innovation, creativity and ingenuity to think outside of our bubble and help plank the curve. We need gamers, YouTubers, TikTok, Snapchat users to join our effort and spread the word to #StayHome. Thank you.
Thank you, Dr. Tam. Et maintenant, je donne la parole à François-Philippe Champagne, notre ministre des Affaires étrangères. François-Philippe.
Merci, Madame la vice-première ministre, et bonjour à tous et à toutes. Il y a un peu plus de 2 semaines, le Canada entamait ce qui allait devenir la plus importante opération de rapatriement de son histoire en temps de paix. En date d'aujourd'hui, en collaboration avec différentes lignes aériennes et plusieurs de mes homologues de nombreux gouvernements, nous avons facilité le retour de milliers de Canadiens venant de plus de 30 pays sur plus de 40 vols. Dans les prochains jours, d'autres vols commerciaux permettront à des Canadiens de revenir du Pérou, de la Colombie, de l'Inde, du Pakistan, de la Pologne, de Cuba, de Trinidad et Tobago et de certains pays d'Afrique. Des Canadiens à bord de bateaux de croisière un peu partout sur les océans de la planète ont pu également regagner le Canada. Et hier soir, nous avons eu la bonne nouvelle que les Canadiens et les Canadiennes à bord du Zaandam seront fort probablement bientôt de retour au pays une fois que le paquebot aura pu accoster en Floride, ce qu'on espère plus tard aujourd'hui, selon les dernières informations que nous avons reçues. I understand that Canadians returning home are all looking forward to be reunited with their families and loved ones. But before they can do that, as the Minister of Health has said many times, and Dr. Tam, I want to take this opportunity to remind them of their obligation to self-isolate for 14 days. This is the law, full stop. This is not the time to stop by the grocery store on the way home from the airport. Our ability to overcome this pandemic depends on everyone behaving responsibly for their own health and safety, for the health and safety of their loved ones, their neighbors, and their communities. In closing, I would like to say a word to Canadians who are still stranded abroad. I understand fully your anxiety. I read your messages, and I understand your desire to come home. We are working literally around the clock and doing everything we can to bring you home as quickly as possible. But I have to say to Canadians, we are facing the most unprecedented challenge that we have ever faced in trying to bring people home, whether it's about airport closure, airspace closure, border closures, restriction in some countries. We are working around the clock to overcome these barriers to bring you home. I must, however, repeat something I've said before. Unfortunately, despite our very best efforts, it will most likely not be possible to ensure the return of all Canadians who wish to come home. For those Canadians abroad who are watching us in the meantime, I want to say please continue to follow the recommendations of local health authorities and take precautions necessary to protect your health and safety. We will assist you in every way we can. La réponse de notre pays à la pandémie du COVID-19 a mis en évidence le meilleur de ce que nous sommes comme Canadiens et Canadiennes, la force de nos valeurs, notre sens de la solidarité et certainement notre résilience dans des circonstances exceptionnelles. Alors, merci, Madame la Vice-Première ministre. La parole est à vous.
Merci, François-Philippe. Now we will hear from the Minister of Indigenous Services, Mark Miller. Mark, please.
Kwe Tansei Ulukut Sego. Bonjour. Good afternoon. Over the last week, Indigenous Services Canada has sent out significant personal protection supplies and is continuing to respond to asks with urgency. We've announced and are in the midst of transferring $305 million directly to Indigenous communities across Canada. And we are continuing to be focused on supporting the most vulnerable of the vulnerable. Avec tout ce que nous avons entrepris jusqu'à présent, nous mettons la priorité sur la flexibilité et la rapidité afin que les leaders autochtones aient ce dont ils ont besoin pour répondre aux priorités aux besoins locaux, y compris, par exemple, la distribution de nourriture, d'eau et de produits de nettoyage aux membres de la communauté en isolement ou en quarantaine, du matériel, des matériaux scolaires pour les enfants, de l'aide pour la garde des enfants, des travailleurs essentiels. To date, there have been a total of 15 confirmed cases of COVID-19 in Indigenous communities. Communities are taking exceptional measures to prevent the spread of virus, including restricting travel in and out of communities, self-isolation, and quarantine of returning travelers, and we will continue to adapt plans and provide surge capacity as the situation evolves. I will reiterate that hand washing and physical distancing remains one of the most effective ways to prevent and slow the onset of COVID-19. I say all this in consciousness of the fact that there is a historical mistrust of government in a number of Indigenous communities. This is a gap that needs to be filled by Indigenous leadership, and they are filling it exceptionally well. But it does provide, it does create a barrier to getting that important message out. And as always, Indigenous leadership is stepping up, and I want to acknowledge that. During this pandemic, many other challenges may arise. For example, we want to ensure First Nation youth in care who reach the age of majority as defined by provinces and territories continue to receive the supports they need. For the next 6 months, at a minimum, we will continue to cover the eligible costs to First Nations Child and Family Services to youth who would have otherwise aged out of care. Again, taking care of those that are most vulnerable. Some provinces have undertaken this change already, and I would encourage others to consider doing the same in support of vulnerable Indigenous youth. Nous avons également recommandé aux Premières Nations qui ont des élections à venir de ne pas procéder à celles-ci, pour le moment, en raison de risques actuels pour la santé publique qui y sont associés. Nous travaillons directement avec ces communautés sur une solution temporaire qui répondra à leurs besoins et garantira qu'il n'y a pas de lacune au niveau de la gouvernance. Dans le cas où une communauté déciderait de procéder à l'élection prévue parce que c'est leur droit, nous sommes prêts à les conseiller sur les mesures à prendre pour limiter les risques pour les membres de leur communauté. We also recognize the unique challenges faced by Inuit communities, including the essential access of air transportation. We're therefore working closely with Inuit partners, provinces and territories, and the Public Health Agency of Canada to ensure adequate preparedness, supplies, and response levels in Inuit communities. We're exploring a number of options to support essential air transportation and ensure that service continuity is provided. Unfortunately, COVID-19 is not the only challenges that Indigenous communities may face in the coming weeks, but it can compound it. As we head into spring and flood season, in particular, we're working closely with First Nations that are at risk of flooding. We're working together to ensure that communities are as prepared as possible for emergencies and have solid flood mitigation strategies and responses in place, while ensuring we protect communities against the spread of COVID-19. I want to reassure everyone that we will continue to support First Nation, Métis, and Inuit in responding to natural disasters such as floods or fires, and we will continue to work with regional health and provincial partners to make sure that First Nations, Métis, and Inuit have the health services and supports throughout this difficult times. We've seen a lot of measures taken by communities to protect their populations, and I want to recognize their important work, the work of health leadership and political leadership, and the strength they have shown. But let me be clear, this is just the beginning. We know more support will be needed, and we will be there to make sure no Indigenous community is left behind. Canada is here to support you during this uncertain time. Miigwech, merci, Nakumik, thank you, merci, Njoo.
Thank you, Mark. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Christia, et bonjour à tout le monde. Soyons clairs, les prochaines semaines vont être déterminantes. Il ne suffit pas de dire hashtag que ça va bien aller. Nous avons une responsabilité citoyenne très importante de suivre les directives de la santé publique. Cela va nous permettre de nous protéger, mais aussi de protéger ceux qui nous protègent. Et on pense en particulier à tous les acteurs du milieu des soins de la santé qui sont en première ligne, qui travaillent fort à la fois dans le secteur public et dans le secteur privé pour nous protéger. J'aimerais aussi dire, suite à l'annonce importante d'hier sur les subventions salariales d'urgence du gouvernement canadien, rassurer tous les secteurs de l'économie, incluant en particulier le secteur culturel, que toutes les entreprises et toutes les organisations qui reçoivent du financement public sont admissibles à la subvention salariale du gouvernement canadien. I would like to add, following yesterday's important announcement on the Canada Emergency Wage Subsidies, I would add for the attention of all sectors, in particular for the attention of the cultural sector, that all businesses and organizations that are receiving public funds are eligible to the Canada Emergency Wage Subsidies. Merci.
OK. Merci, Jean-Yves. Et on est prêt à répondre à vos questions. Carl?
Thank you, Deputy Prime Minister. As usual, we'll take 3 questions on the phone and then turn to the room. 1 question, 1 follow-up. Operator?
Thank you. Merci. The first question is from Lina Dib from La Presse Canadienne. Please go ahead. Votre ligne est ouverte.
Oui, bonjour. My question is for Minister Hajdu. So more and more people are asking for scenarios that you have or don't have. And the Prime Minister this morning said that you first want to make sure that the data is consistent. So I want to hear you on how consistent is the data, especially from Ontario and maybe also from British Columbia. Are you okay with the numbers that you see? Do you think they do represent the reality?
For the question, and I'll start and then turn to Dr. Tam for some specifics. First of all, I echo the Prime Minister's statement that in order to do modeling, we need accurate data, and the provinces and territories have been working really hard to get to a place where they can provide us with that. We have facilitated that by providing portals and all kinds of other technical support for them to be able to provide as much granular data as possible. Of course, all of that data feeds up into the modelers that we're using both within the Government of Canada and a number of other modelers that are professional modelers from our academic societies and research community. And the reason why this is a difficult question to answer is because each particular scenario depends on a number of different measures. So let's just take, for example, what we could anticipate in terms of the volume of deaths in Canada. In order to actually answer that question, we actually have to get a better handle on how many people we anticipate will be infected in Canada based on what we currently see in terms of infection rates. Of course, that's dependent on the number of measures that are taken in various jurisdictions and how stringently they're being applied or listened to by Canadians. And it also depends on the number of Canadians that end up hospitalized and in some cases using intensive care services. And all that depends on whether or not Canadians are able to apply those own measures in their own lives. And so that's why it's very hard to give modeling that's accurate. Having said that, that's the work that we're doing right now to give Canadians a better sense in the days to come. Should we be able to see a mild outcome, a moderate outcome, a more severe outcome, and what kinds of decisions, what kinds of measures, and what kinds of capacities would affect those outcomes. So I'll turn to Dr. Tam, and maybe you can speak specifically about the work that you're doing to get that data from provinces that will help us with that modeling work.
I think everyone's working really hard to get the information. Right now, I would say that we are looking at how do we interpret the information we've received as well. So when we talk about modeling, there are many different types of modeling. there are scenarios for planning purposes where you could hypothetically sort of look at, well, how many percentage of your population may get sick and sort of plan ahead at your hospital beds, for example. But what we're doing with provinces is take the data that we have now, like the number of positive cases and confirmed cases, to see if we can track where we're heading. But you can't go too far. You can't sort of guess, months down the road. What you're looking at is whether the numbers, those numbers that we get reported every day, are pointing towards us in a certain direction, whether that curve is bending. That curve bending is still actually in early days, as we've all said. The next weeks will be very important. We're not expecting to see too much at this point. In setting up that curve and looking at whether it's bending, what we're doing is fine-tuning the interpretation of our information. BC, for example, we need to know exactly what happened to their testing strategy. As I've just said, the testing strategy depends on where you are in that epidemic curve, how wide a net you might be casting or more focused. So until we get the precise the nature of the exact testing strategy at each point in time, will help us to see if we can compare the data from each of the jurisdictions. And it's not an easy piece of work just because people are tested all over the country, and we need to make sure we understand how to interpret. Now, public health, of course, as I said, don't just move on perfect data. We will take what we have and we will make the most of that in terms of giving us our best interpretation as to where this epidemic is heading. And we also do have to unpack it for each of the different areas of Canada. They're not experiencing exactly the same outbreak and the same trajectories. So we are dependent on each of the jurisdictions and helping them where they don't have the modeling capacity to get that done within each of the provinces and territories.
Okay, so if I can, Minister Hajdu, if I can go back to Ontario, Mona Nimmer, who is the conseillère scientifique du Canada, was saying this morning that was what she's seeing. Apparently, Ontario is not testing enough, and they should be, and she's preoccupied with that. Do you share her concern about the way Ontario is handling the situation?
Thank you for the question. I'm going to turn that directly to Dr. Tam because she is much more closely linked with the public health officers of Ontario and can answer it from a more precise place. Thanks.
Yeah, so I think the evolution of the outbreak is, as I said, the timing and everything is a little bit different. BC started a little bit earlier. I think the Ontario situation, and Ontario is a very vast place. So, and they're at some of the beginnings of that epidemic curve. So I think that we will provide support as much as possible to Ontario to enhance their testing capabilities for sure. We want to absolutely, though, as I said, test and focus the testing in the most high-risk situations, if you like. You must test long-term care facilities, healthcare workers, and all of those situations where the test results in a significant public health action. So you must control those outbreaks. So making sure that's where you're focusing is very important for Ontario, particularly, for example, in the Toronto area right now. It may be reasonable then to cast the net wider and elsewhere in Toronto, in Ontario, where the disease epidemiology might be a bit different. So it's not a very simple answer, but all I can say is they need more testing capacity. We are absolutely working together to make sure that capacity is improving. And we can certainly provide you more information in the upcoming days.
Thank you, Dr. Operator. Prochaine question.
Thank you. Merci. The next question is from Jamie Passas-Gumscombe from APTN. Please go ahead. The line is now open. Votre ligne est ouverte.
Thank you. My question is concerning Canada's prisons and jails. With people with respiratory illness, they may see that this epidemic is almost a death sentence to them. What is the committee doing for them?
Thank you for the question. We are very aware of the particular challenges that people in jail and the people working in jails and prisons face in this situation. Minister Blair is very seized of this issue and addressed it at the COVID-19 Cabinet Committee earlier this week. He and his team are working very hard to ensure that protective measures are in place to protect both inmates and guards. You're quite right to focus on this issue, and we are as well. And Minister Blair is looking at whether further action may be necessary.
And if I can just add, Dr. Tam has a few words because she's been working on this issue as well.
Yeah, so correctional facilities are one of the high-risk settings. And they are precisely when we talk about lab testing, we need to be able to provide lab testing to those settings. They are one of the highest priority areas for focusing our lab test capabilities. We provide guidance to these type of settings, and also the medical officers of at the federal level at the Correctional Services Canada is part of our group of chief medical officers who are constantly looking at the evidence and looking at how best to protect this population. But of course, the key is not to introduce this virus into that setting. So the preventive measures, which are really, really important, I can't stress enough about that. So absolutely double down in prevention of entry of the virus.
Thank you, Dr. Operator. One last question on the phone before we turn to the phone, to the room. Sorry.
I had a follow-up.
Yes, sorry.
Yeah, my question is for Mr. Miller. You mentioned the $305 million going out to communities. Could you just clarify, has that begun now? Are communities now receiving this money?
Thank you, Jamie. Two things have occurred. We had emergency funds in our regional offices that have been dispersed. That is only a fraction and not included in the $305 million. That has, to the best of my knowledge, been distributed. Over the course of the weekend, my regional offices sent out letters on late Friday, early Saturday morning, confirming the individual community allocations. Those have been received, and disbursement is expected to occur within the next week.
Thank you, Minister. Operator, next question.
Thank you. Merci. The next question is from Marie Vestel from Le Devoir. Please go ahead. Votre ligne est ouverte.
Oui, bonjour, Minister Hajdu. I think this is for you, unless it's for Dr. Tam. I'd like to go back to the medical equipment that was promised to Quebec. Yesterday, it was said that some equipment would be delivered in the next 2 days. I'd like to know what day it's going to be shipped to Quebec, what equipment is being shipped, what quantity of that equipment is being shipped, and also on the 10 million masks that the Prime Minister mentioned was just delivered and is going to be redistributed to provinces. Can you tell me what proportion of that is going to go to Quebec, please?
Oh, thank you for the question, and I'll just give you some numbers. I know there's a lot of interest in personal protective equipment and what's gone out. Since the start of the week, we've received in Canada over 10 million masks, as the Prime Minister said, thanks in large part to a company called Medicom. And overnight, we received a shipment of 1.1 million masks from a supplier that has now arrived in Hamilton. We've also validated a donation of 500,000 masks from the Jack Ma Foundation in the last 24 hours and another 700,000 from our government stockpile, which will be going out to provinces and territories very quickly. And these masks, along with thousands of gloves and swabs, are being distributed across Canada. We are also in the process of shipping 174 ventilators, and more are being dispatched. And we have more shipments on the way, and the procurement minister and her team are doing an amazing job in a very incredibly difficult procurement landscape. In terms of the allocation of what's going where, that work is happening with the provinces and territories through the Special Advisory Committee that Theresa works through, and through the Deputy Ministers of Health. that is a very difficult, as you can imagine, conversation, but important one, because the provinces and territories are working incredibly collaboratively to make sure that not only their needs are met, but that we can anticipate surges in parts of the country as they occur. So I cannot give you specific numbers of which provinces and territories have received what. Certainly you can ask various ministers of health at the provincial level if that's the information they want to share, but at the federal level, what I will say is we are very encouraged by the collaborative nature of these conversations in a very difficult time. And that's what we need to see. We need to see Canada pulling together, provinces and territories, obviously preparing for their own particular scenarios and their own particular surges, but also to be understanding that if product is needed across the country in an area where there is a surge, that they will be there to help their fellow Canadians. And we have seen every indication that that's what's happening.
Thanks for all the numbers. I appreciate it. Maybe then, if you can't give me the specific numbers, can you tell me how all those resources are being allocated? And what I mean is it in a percentage of where there are the most dire needs, they get a bigger percentage, or is it simply through the regular proportion of the population of Canada, so i.e. Quebec and Ontario would get about 20-25%? And my other question is, we've seen some smaller distributors in Canada who are trying to order shipments of medical equipment, but are getting sort of outbidded by the U.S. amongst others, and they can't keep up in the bidding war, essentially. And I wonder if there's any potential role for the federal government. Could the federal government sort of take over being in charge of all these orders of medical equipment to avoid that smaller distributors get outbidded?
So that's technically two questions, but I'll answer them both. So on the allocation formula, part of it is population-based and part of it is held back for need. So it's a really careful formula that's built around the kind of population that people have, but also the ability to rapidly redeploy resources to an area where we see a surge. So those proportions are being worked on right now, and at the end of the day, what we would like to see and what we're getting to is a consensus from all provinces and territories that the formula meets their needs and that they are comfortable with that formula. In terms of bidding wars and people scooping orders and all the other kinds of crazy things that are happening in the procurement space of personal protective equipment, certainly I've heard those stories as well, and that's why we're encouraging provinces and territories to work as closely with us to do bulk procuring at the federal level. It does give us bigger clout when Team Canada is buying things, and Canada, the full weight of Canada is behind those orders and those logistics that go into actually getting product from many countries, but particularly China. In terms of that work, obviously we know that provinces and territories do have separate orders, and we encourage them to communicate that to us so that we can keep an eye on those orders and assist them as well with any logistical challenges that they're having. We've contracted services for domestic distribution through Amazon and other providers, and that will help make sure things can get to places very quickly in Canada, but we also have the capacity to help them with orders that are stranded around the world.
Merci, Madame la Ministre. On va prendre les questions dans la salle. Kelsey Johnson-Reuters.
My question is for Minister Freeland. Given the news that has broken around a potential agreement on oil curtailments with OPEC, I'm wondering, does Canada support global coordinated cuts in oil production? And is it involved in talks with the U.S., the Saudi Arabians, and Russia, or others about limiting production?
We are very aware of those reports today, and we have been concerned for some time about the ways in which the actions of Russia and Saudi Arabia have disrupted the world energy market. That has had grave consequences for the Canadian energy sector and for the Canadian economy more broadly, and that is something we are really focused on. Canada has been in very close contact with the United States about this issue. I have spoken with Secretary Pompeo about it. Our Ambassador Kirsten Hillman has been working closely with the State Department on this issue. And we have also been in close touch with both the province of Alberta and leaders in the Canadian energy sector. Just late last night, I spoke to Premier Kenney about many things, but very much including the global energy market, and also with Russ Geerling. And Minister O'Regan has been in very close touch with his Alberta counterpart and also with his U.S. counterpart. So we have been very engaged. We are watching the situation closely and are very involved.
So is Canada considering participating in a global coordinated effort to curtail oil production?
Let me just say that this is a very fast-moving situation. The current situation in the global energy markets is something that we're very concerned about. The impact on Canada, on the Canadian energy sector, and on the Canadian economy more broadly has been very negative at a time when our economy is suffering a lot of other strains. It's too early to say how this situation is going to develop, but we're very closely engaged. And I would also like to say Premier Kenney is very involved, and he has also been personally involved in conversations with the U.S., and that has also been very helpful.
Thank you, Deputy Prime Minister. Ian Wood, CTV.
Minister Freeland, where should people make up the shortfall that CERB isn't going to cover? Should they run up their credit cards or search for payday loans or lines of credit? There hasn't been much forward thinking or outlook in terms of what happens after 4 months of receiving CERB and they've run up debt. Where should they get that credit?
I don't really agree with many of the premises packed into that question. But let me just say the following. The government of Canada very much understands that the impact of the coronavirus, both on the global economy and on the Canadian economy, has been huge. And we also understand that the steps we are strongly urging Canadians to take to protect the health and safety of all of us have a devastating economic impact in and of themselves. And that's why the government has stepped up with the largest economic response in Canadian history to support the Canadian economy, with the CERB to support people who have lost their jobs or can't work because of the coronavirus, with the 75% wage subsidy. That in and of itself is the single biggest economic program of any Canadian government, and with huge injections of liquidity into the financial system to allow banks to lend. This is truly an immense response, and that's right, it is commensurate with the size of the issue. Now, you asked what happens after 4 months, and to that point, I would like to say to Canadians, this situation is under constant review. I don't have a crystal ball, and Dr. Tam doesn't have a crystal ball. No one does. But what I can assure Canadians is we will do whatever it takes for however long it takes to keep individual Canadians able to not just get by, but really support themselves in a decent way, and to keep Canadian companies whole and sound. So, we are here for the long term, obviously, and the government of Canada truly has the fiscal firepower to do whatever it takes. No G7 country entered this crisis in a stronger fiscal position than Canada, and that really should reassure Canadians that we are there for them today. These economic measures are huge, and we are going to be there for them for however long we need to before the Canadian economy, until the crisis ends, and it will. This will end. We can't say exactly when, but we know it's going to end. And when it does, our job as a government is to be sure that individual Canadians and Canadian businesses are able to come roaring back.
Right. My second question I'll get to in a second, but what I meant to clarify was, are we asking banks to defer personal loans so much as those same actions we've taken with businesses? But my second question is for Minister Champagne and also Minister Hajdu and Dr. Tam, partly. U.S. intelligence yesterday, it was reported that they've shown that China had taken steps to cover up the outbreak when it initially happened and continuing thereafter underreporting numbers, information to the WHO. And there's stories of them discrediting one of the doctors that discovered this too. Do we trust China to provide accurate information to the Canadian government? And also, if we're making projections based on outcomes globally and also what we're seeing here at home, how can we be assured of accurate modeling if the country that was the center of the outbreak has been lowballing or hiding its data?
Well, I would say, first off, we are very concerned about disinformation. I just had a call with the NATO allies a few hours ago. Canada gets its data from the World Health Organization. We trust the international UN bodies to provide accurate information to different bodies around the world. We will continue to do that, but I can assure you that we're very much aware of the stories that are going around the world, that we need to speak with one voice as liberal democracies in upholding, obviously, facts and science-based approach when it comes to a crisis like that. People watching at home deserve answers. They deserve data. They deserve the truth when it comes to actual data. And I can assure you that not only we're working with the G7, the G20 partners and NATO this morning, we are well aware of the fact that we need to work on a multilateral basis to provide the most accurate information so that not only Canada can base its assessment on data, but also other allies. And I can assure you there's never been a better time to cooperate, consult, and coordinate in the world when it comes to this. This is an enemy that is invisible and knows no border. So we're all committed in putting resources to fight it. But I'll turn over to Minister Hajdu if she wants to provide additional on that.
Well, I think the most important thing that my colleague mentioned was that we don't rely on any one country's source of data. In fact, it's the World Health Organization that coordinates the data from all countries. Dr. Tam is a special advisor to the committee that's been working on the pandemic since the very early days. Dr. Bruce Aylward led the World Health Organization committee to China to do the investigation of what was happening, what they could determine on the ground in terms of China's capacity to have a full understanding of what was happening. There's no indication that the data that came out of China in terms of their infection rate and their death rate was falsified in any way. In fact, if you look at the death rate overall in China, it's much higher than the one we're seeing now. And so we rely on the World Health Organization to do this important work because, of course, we're all in this together. And I think one of the most important things to understand about this pandemic, this global pandemic, is that as long as coronavirus exists in one country, and it exists in all of our countries, that we actually have to work collectively as a world now to defeat this virus, to find better ways to treat and then eventually prevent this virus through vaccination or other kinds of methods. And that's going to take everybody working together. And
sorry, please let her finish. No.
China has shown that they've
Ian.
How can we trust the World Health Organization?
so I would say that your question is feeding into the conspiracy theories that many people have been perpetuating on the internet. And it's important to remember that there is no way to beat a global pandemic if we're actually not willing to work together as a globe. We will have to come up with a global solution to this virus. No country is an island. And I am so proud of the Canadian researchers that are part of the World Health Organization Solidarity Project that are working on developing vaccines and treatments for this virus that undoubtedly are going to be a big part of the solution about how we all get ourselves out of this situation.
Thank you, Minister. Julie Van Dusen, CBC.
Ms. Hajdu, we know that hundreds of foreign-trained doctors really want to help out in this situation. We know that they've passed required tests, but they haven't been certified yet by officials. We're pointed to the fact that one of the first Syrian refugees who arrived here in 2015 is a doctor who wants to help out, but he can't. So is there any way to facilitate getting these doctors into the system?
I'll give a general statement, and then maybe Dr. Tam, this has come up on your special advisory committee calls. The short answer is yes, provinces and territories are looking at every possible way to get more healthcare professionals on the front line, including asking retired professionals to come back, including accelerating exams for those who are close to graduating from a variety of different professions, and including looking at how we actually better get at the credentialing of healthcare professionals from other countries. It's a difficult piece of work, but I'm sure Dr. Tam has more specific updates.
Yes, I think it's important to look at, in every angle, at improving our health human resource during a difficult time. So Health Canada actually has initiated a recruitment approach whereby, and I don't know if it's actually launched on our website or not, essentially is asking people who've had the skill sets to do public health, like contact tracing and other skills that provinces are looking for, to actually apply to that portal. It's not the same as getting your license, I have to say. That is a sort of provincial licensure area, but we would like people who think they can help in the health response to be applying through that particular portal.
Second question is for Dr. Tam. So at the Health Committee in January, you said that even though it was possible for people with symptoms to spread the virus, it's rare. So now that we know it's not rare, I'm just wondering if you regret being so definitive.
People with symptoms are obviously very important in the spread of this virus. We're always, obviously looking at science as it evolves. And we have, of course, had cases that are pre-symptomatic or asymptomatic. What we didn't know before was how much that play in the force of transmission. And you actually have to unpack that science a bit. And this is very much live in terms of the scientific community, rather, in terms of its analysis. It may depend on what setting you're in as to whether that particular component play any part in driving the actual outbreak. So as I've said, areas like long-term care facilities, we now have to look at, well, what does this mean exactly if particularly in patients or residents who can't really describe their symptoms or doesn't really, they may be pre-symptomatic. So all of this is very much currently being integrated in terms of the scientific analysis. And so if we have to change our approach, we will, because this is just the science that's building up right now.
Merci, docteur. Impératrice, on va tourner au téléphone pour 3 questions.
Thank you. Merci. The next question is from Micheline Laflamme, Radio-Canada. Your line is open. La parole est à vous.
Je vous remercie. Ma question s'adresse à Dr. Tam. J'aimerais si vous pouvez me dire un petit peu en français là, comment vous en arrivez pour en ce moment vous dites que l'analyse, la modélisation des modèles va venir prochainement. Donc qu'est-ce qui est important, qu'est-ce que vous suivez en ce moment pour être capable justement de nous donner des informations sur cette analyse et aussi sur la capacité de tester en Ontario. Vous avez dit que vous voulez aider l'Ontario. Alors qu'est-ce que vous êtes en train de faire en ce moment pour augmenter la capacité là-bas?
Yeah, Dr. Njoo is going to answer. Dr. Njoo va répondre. Vas-y.
OK, merci pour la question. C'est sûr que Dr. Tam et moi, et aussi avec nos homologues des provinces et territoires, on continue à travailler étroitement. On a des experts qui travaillent dans le domaine de modélisation. Et c'est sûr que Dr. Tam aussi a dit que chaque province a leurs propres experts qui font leur propre projection et modélisation. À l'échelle nationale, fédérale, on travaille étroitement pour aussi avoir des projections. Mais comme on a déjà dit, il y a 2 aspects. Le premier aspect, c'est la qualité des données. parce que si on n'a pas des données de bonne qualité, les projections, ce qu'on peut faire ce qu'on reçoit comme résultat, c'est pas fiable. Donc, c'est numéro 1. L'autre aspect, c'est aussi que si on fait une modélisation, c'est toujours aussi, c'est dépendant ce qu'on fait actuellement avec nos mesures comme l'éloignement physique. Parce que si on est vraiment efficace comme toute une population, aussi comme tous les Canadiens et Canadiennes, ce qu'on fait actuellement maintenant, ça va aussi avoir un effet sur la modélisation. Qu'est-ce qu'on peut attendre dans quelques semaines? Donc, on continue à travailler étroitement et c'est difficile de donner des chiffres parce que ça dépend des deux aspects. La qualité des données on reçoit actuellement, on travaille étroitement. On sait que les provinces et territoires continuent à travailler fort pour avoir les meilleures données que possible. Et aussi, l'autre aspect, c'est toujours ce qu'on fait maintenant, actuellement, c'est très important. C'est critique parce que si tout le monde, tous les Canadiens et Canadiens, continue, on espère, de pratiquer les bonnes pratiques comme l'éloignement physique. Ça peut avoir un effet sur les données et aussi sur les résultats des modélisations. Merci.
Et l'Ontario?
Ontario, oui, c'est sûr que Ontario est en train d'augmenter leur capacité pour tester, dépister la population. Et Dr. Tam et moi et nos homologues, on continue à travailler fortement pour aider les autorités sanitaires de l'Ontario pour augmenter leur capacité pour tester leur population.
Merci. Et est-ce que je pourrais, M. Champagne, vous demander si dans les entretiens, les discussions que vous avez avec vos partenaires à l'étranger, vous discutez justement de l'achat d'équipements médicaux et de ce qu'on entend là en ce moment qui fait en sorte qu'il y en a qui achètent sur le tarmac et ces équipements-là donc n'arrivent pas à bonne destination. Vous avez une discussion avec les gens de l'OTAN ce matin. Est-ce qu'il y en est question?
Ben, écoutez, tout à fait. C'est sûr que depuis le début, on savait qu'on faisait face à une crise sanitaire et on voulait aussi dire qu'on doit s'assurer de la sécurité économique et de la sécurité alimentaire des gens. Vous vous rappellerez, dès le début, on a dit qu'il fallait d'abord assurer le passage essentiel, donc le transit essentiel de gens qui devaient passer d'un côté et de l'autre de la frontière, mais aussi les chaînes d'approvisionnement et particulièrement en Amérique du Nord, parce qu'on sait que les chaînes d'approvisionnement sont très intégrées. C'est pour ça quand on a eu l'entente avec les Américains de fermer la frontière, il y avait besoin de coordination, c'est-à-dire pour nos camionneurs, évidemment, qui passent, mais toutes ces marchandises-là. Alors, depuis le début, le Canada a rassemblé des pays en disant, vous vous rappellerez, on a parlé même des ponts aériens qui existaient dans le temps de la Deuxième Guerre mondiale, où on disait il faut s'assurer que les services essentiels continuent d'un continent à l'autre, que ce soit des chercheurs, que ce soit des techniciens pour la machinerie et l'équipement, mais évidemment des chaînes d'approvisionnement. Donc, il y a différentes initiatives, mais c'est certainement quelque chose dont on a besoin, parce que je pense que la ministre Haidou le disait, c'est le combat de l'humanité. Nous sommes réunis comme humanité versus un ennemi commun qui est invisible et qui est partout sur la planète. Alors, c'est clair qu'on comprend que dans l'intérêt individuel, mais dans l'intérêt collectif, on doit maintenir ces chaînes d'approvisionnement-là ouvertes pour permettre aux biens essentiels de pouvoir traverser les frontières durant cette période-là qui est sans précédent.
Merci, Monsieur le Ministre. Operator, next question on the phone, please.
Thank you. Merci. The next question is from Raymond Filion, TVA. Please go ahead. The line is now open. Votre ligne est ouverte.
Sur le même sujet, mais avec Mme Freeland, au sujet de ces reportages qui font état de cargaison d'équipements médicaux comme des masques destinés au Canada, entre autres, et détournés aux plus offrants, en l'occurrence les États-Unis. Le premier ministre Trudeau, ce matin, a dit on est en train de soulever cet enjeu spécifiquement. Je crois comprendre que c'est avec Washington. Pouvez-vous nous éclairer là-dessus? Est-ce que le Canada a déjà discuté avec Washington de cette pratique-là?
On a une étroite collaboration avec nos voisins américains et je dois dire que chaque jour, peut-être chaque heure, on soulève des questions de la frontière et on soulève des questions du passage par la frontière à des choses duquel on a grave besoin, des choses médicaux. C'est une conversation intensive et c'est une conversation dans laquelle tout le gouvernement prend part. Je veux remercier le ministre Harj Sajjan qui joue un rôle très important dans nos conversations avec les États-Unis et bien sûr notre ambassade. Nous devons comprendre que maintenant, pour nous les Canadiens et aussi pour nos voisins américains, c'est une situation très difficile, c'est une situation très grave. Jusqu'à ce moment-là, nous avons une bonne collaboration avec nos voisins américains concernant le passage par la frontière des choses médicales duquel nos deux pays ont un besoin urgent. Évidemment, il y a toujours des moments, des enjeux spécifiques et quand on a un enjeu spécifique, un enjeu difficile arrive, on soulève l'enjeu immédiatement avec nos voisins américains. Jusqu'à ce moment, on a réussi à résoudre tous les enjeux, mais c'est un travail qu'on doit faire chaque jour et je pense que ce sera nécessaire de continuer chaque jour enjeu par enjeu, travailler, essayer de résoudre chaque enjeu.
Donc cet enjeu spécifique, est-ce que vous l'avez résolu? Avez-vous l'assurance à ce moment-ci que cette pratique de surenchère des Américains va cesser?
Nous sommes en train de travailler sur ça, mais je veux vraiment souligner que même aujourd'hui, nous avons une situation grave au Canada, mais je pense que tous les Canadiens comprennent qu'aux États-Unis, la situation est aussi très, très grave. Et même dans cette situation, nous avons vraiment une bonne communication avec nos voisins américains, une bonne collaboration. Les États-Unis est un très, très grand pays. Il y a beaucoup des acteurs spécifiques et il y a beaucoup des enjeux parce qu'il y a beaucoup de commerce par notre frontière. Mais jusqu'à ce moment-là, tous les enjeux, on a en bout de ligne à réussir à résoudre. Il n'y a pas de garantie pour l'avenir, mais je peux assurer les Canadiens qu'on travaille, on fait du travail acharné sur cet enjeu et je dois dire aussi que jusqu'à ce moment, on a une bonne collaboration, une bonne compréhension du côté de nos partenaires américains. Ils comprennent que le Canada est un voisin et le plus important partenaire économique et aussi que nous sommes un allié, l'allié le plus proche militaire pour les États-Unis. Et toutes ces choses sont importantes pour eux et ils doivent être importants pour eux.
Thank you, Deputy Prime Minister. We'll take two questions from the room and then two last questions on the phone. Dylan Robertson, Winnipeg.
We're getting some requests from First Nations for military support. I know that they have to work with the provinces, but some of them don't have a trust relationship with their province. I'm wondering if it is a nation-to-nation relationship, what happens in the case of a request where the province doesn't feel like that's necessary, especially in the context of the prairie flood season?
Hi, Dylan. When talking about the military, you're talking about very, very difficult scenarios that no one wants to contemplate, that we do have to provide for. And so when we're looking at scenarios, we're looking at catastrophic scenarios, scenarios in which the military would be deployed to assist, evacuate in some cases with northern and remote communities, or assist in setting up triage situations, hospital-like situations. These are very, very grave requests that we need to consider as a country together, working with the province and the way that medical services are provided. We can't exclude the province from that conversation, but we do have the capacity to step up and plan together. There are a number of requests that are coming in that contemplate the use in various forms of the military. It's something that I and the Minister of Defence and the entirety of government take quite seriously, but we're looking at a number of scenarios that would provide for that, because we can't it would be foolish to exclude those scenarios, even though they're things that we don't want to contemplate. So when we get those requests, we engage with the communities first and foremost. We will not go in without cooperating with the communities in particular. But when those requests come in and we deal with them together, I think everyone in Canada wants to see a solution that will ensure at the end of the day that we're all saving lives.
Our nurses are circling in and out on a 2-week basis. They're obviously not quarantining for 14 days if they're working for 14 days. I'm curious if you've looked at that issue, if you want it to stop, if you want them to stay in place because they are working with the most vulnerable people in the community.
Absolutely. Making sure that those health protocols are in place are essential to ensuring that the spread of COVID-19 doesn't occur within the communities through the healthcare workers that are there in the first place to help prevent it or slow the spread. And so that's something that we're looking at directly with communities, especially those that are remote, because in those situations you're flying people in and flying people out, and so those are all issues and grave ones at that we have to tackle when a community, for example, decides to close its community. We need to ensure the ability of workers to come in, health workers in particular, but also health supplies and people to go out. And I think particularly of situations where women have to go out for birthing reasons. And so on the specific issues of nurses and health protocols, I'll pass that over to Tom.
We have protocols in place in order to prevent the transmission or the introduction of the virus into the community, working together with the community. And we modified and escalate our approach as the virus evolves throughout Canada. Thank you.
Thank you, Doctor. Mike, Global.
With the rules outlined with the CRE, whatever. Students who've had summer jobs, they've been canceled, and they have no potential to get new summer jobs possibly. They're not eligible for this. So what are we doing for these students who are now out of luck and they need the money for their next year or whatever?
Thank you for the question. The overall objective is to make sure that those who are currently going with no income, they have lost their job, they have lost all ability to pay for their expenses, including for food on the table. These are covered by the CERB. In addition to that, as we know, but as we need to be stressing again, yesterday's announcement on the Canada emergency wage subsidies reinforces the ability of everyone, and in particular businesses across Canada, to hire or rehire or not lay off workers that would normally not be without a job in the current circumstances. So this is all helpful to all of these Canadians that are anxious about their ability to make ends meet, and all of these businesses that are anxious when it comes to trying to secure their ability to support their workers, not only now, but in the future when the economy recovers. And that's therefore of great importance, and I think of interest to all Canadians, including students, who would often want to be available to return to their jobs in circumstances in which that would not be feasible in the absence of the wage subsidy, and if not, then gaining support when.
A new vaccine, and I have to say that even if people have discovered some great innovations, they're not going to be available for a significant period of time, so at least 12, probably longer, 12 months or longer. And vaccines always go through specific steps in terms of clinical trials and testing them in healthy adults first, for example, and then expanding those strategies as the trial progresses. Of course, when you're in a pandemic situation, regulators, scientists, the private sector will try and reduce the amount of time that you may need to do to go through each of those stages, but not sacrificing safety. So, of course, any severe safety issues will immediately trigger a review of that trial. So there are monitoring boards that are there separately to monitor the progress And these trials will be blinded, for example, and they will have some results if these signals appear to stop. Otherwise, of course, there are some very general vaccine side effects that might be expected of most vaccines in terms of local side effects, bit of fever, that type of thing. If it's not severe enough, the trials will progress. And so I can't tell you with each of these vaccines what's going to happen, but all to say is that there's an international network of the regulatory authorities as well as the sort of clinical trial and research boards, and they all have this sort of fail-safe mechanism of cutting out a trial if it's unsafe.
Thank you, Doctor. Because we're short on time, we'll take one last question on the phone.
Thank you. Merci. The participant is Philippe Vincent Foisy, Radio-Canada. Please go ahead. Your line is now open.
Oui, bonjour. Je voulais juste revenir un peu sur ce que vous avez dit tantôt là, sur les tests, les modèles, etc. Est-ce que, parce que vous disiez que ça prend des qualités, des données de qualité de la part des provinces, est-ce qu'en ce moment, vous jugez que les données que vous avez de la part de toutes les provinces sont de qualité ou il y a des provinces en ce moment qui sont un peu plus récalcitrantes?
Oui, merci pour la question. C'est Dr. Njoo. Oui, la qualité des données qu'on reçoit actuellement à l'agence, c'est de bonne qualité. L'enjeu actuel, c'est la rapidité, aussi est-ce que c'est la totalité des rapports, parce que comme Dr. Tam et moi, on analyse, on a des analyses pour au moins à date environ 50% des cas actuels qui sont signalés aux provinces et territoires. Donc, c'est un enjeu actuel pour tout le monde. On peut faire seulement une analyse à l'échelle nationale, fédérale, avec les données qu'on reçoit. Donc, je pense que ce n'est pas nécessairement une question de qualité, mais de ramasser, de faire les entrevues. C'est vraiment un travail très difficile, comme on a dit, le suivi des contacts, faire les entrevues, poser toutes sortes de questions concernant l'exposition. Et puis, finalement, si on fait ça à l'échelle municipale, locale, il faut envoyer les données à l'échelle provinciale, territoriale et finalement, nous autres ici, à l'échelle fédérale. Ça prend du temps et nous autres, on sait qu'il faut travailler fort, il faut travailler aussi vite, mais il faut aussi avoir des données de qualité.
Puis, M. Duclos, sur les programmes qui ont été annoncés pour aider les gens, il y a beaucoup de gens qui nous disent, moi j'ai un petit contrat, j'ai un 100 $ de contrat par semaine, mais donc j'ai pas une perte de revenus totale, même si mes revenus sont presque nuls. J'aurais pas le droit à la prestation canadienne d'urgence. De l'autre côté, il y a des petites et moyennes entreprises qui disent, nous, on a connu des hausses de chiffre d'affaires de 300-400% dans la dernière année. Donc c'est sûr que si on compare avec l'année dernière, on n'a pas connu une perte de 30% de nos revenus, même si on a connu une énorme perte de revenus qui vaut peut-être plus que 30% que les derniers mois. Pour tous ces gens-là qui ne sont pas dans les programmes que vous avez mis en place, est-ce qu'il va y avoir quelque chose bientôt?
Bien, merci pour la question. Puis je pense que vous expliquez très bien là, dans le contexte d'urgence dans lequel on travaille, les programmes que l'on met en place sont nécessairement imparfaits. Et deux choses là-dessus. Imparfaits, même s'ils sont très significatifs. Je résume rapidement là, pour que tous les Canadiens comprennent. On a la prestation canadienne d'urgence qui est là pour aider ceux qui perdent tous leurs revenus à pouvoir joindre les deux bouts au cours des prochaines semaines. Et on a la subvention salariale d'urgence du gouvernement canadien qui est là pour aider les entreprises à verser 75% des salaires allant jusqu'à 58 700 $. Donc, c'est deux gros piliers d'aide à la fois aux travailleurs et aux entreprises pour profiter dans les deux cas aux travailleurs à la fin, parce que ce sont les travailleurs qui sont souvent dans des conditions de précarité très importantes. Maintenant, il y a du travail additionnel qui va continuer d'être fait parce que malgré les annonces qui ont été faites hier encore et au cours des derniers jours, il y a encore beaucoup de détails à fournir et beaucoup de détails auxquels les Canadiens aspirent parce je pense que les Canadiens sont conscients que tous et toutes au gouvernement canadien certainement, et ça vous inclut vous aussi, Philippe Vincent et tous les journalistes ont fourni autant d'informations qu'on le peut à la vitesse grand V, mais encore d'autres mesures qui vont devoir être précisées et probablement d'autres mesures qui vont prochainement être annoncées à nouveau pour que tous puissent passer à travers de cette crise.
Merci, Monsieur le Ministre. Ceci met fin à la conférence de presse. Thank you all.
Hello again, I'm Peter Van Dusen. We've been listening to federal cabinet ministers and federal health officials and their daily update for Canadians. As you heard, the number of cases in Canada now surpassing 10.
All right, that concludes the update from the Canadian health officials on COVID-19, and we will talk to you later on. Thank you for listening to Depictions Media.